I think our theme here is game changing. And the game changer in this topic is how do we innovate to improve value? How do we innovate to improve value and the value that technology can bring to healthcare? So that begs the question, what is value? The key issue is that value is not an input, like price alone. It's an output. It's outcomes over dollars.
Let me give specific examples. First is the Odon device. This is an innovation developed by WHO, and it is used in obstructed labor. And that is a major cause of maternal deaths. And the device, developed by the organization with scientists, now is undergoing clinical trials. It's inexpensive, it's ingenious, and it's so simple that it can be used by lower-level staff. If approved, this will be the first new assistive device since forceps and vacuum extractor. Also undergoing large clinical trials is a very simple paper checklist for safe childbirth. The result of an initial study conducted in India was published last month, and following introduction of the checklist, you don't believe it, adherence to acceptable clinical practices improved by 150%. There is no additional resources required. It's just a simple paper checklist. These are just some examples of what I call strategic innovation. They are simple and frugal, and they help save lives and reduce the cost of care. And they can be game changers. Also, they can continue to fuel and sustain the unprecedented momentum for better health in the first 10 years of this century, and we must maintain the momentum.
You gave 3 examples of innovations that truly improve value. The meningitis vaccine, the Odon device, the maternal child checklist. Those are better outcomes per unit of cost compared to what existed before. I think we should just acknowledge up front the reality that that hasn't been the way we've always thought about innovation. Most innovations are slightly better and a lot more expensive, so the value in some ways actually is the same or a little bit worse. So innovating on value is really key, and you gave 3 great examples.
My plea for the industry would be that if we focus on the high medical need, and we focus on the patients, and we try to get our head around what is transformational in terms of the innovation, that we will be adequately rewarded at the end. And that is a belief we have. And that belief we need to be able to keep that, otherwise we will not invest. And the second thing that I want to add to that is predictability. And it's regulatory predictability, and it is value predictability. And that is key.
Coming from Uganda, a poor-resourced country, our greatest challenge is how to access the newer, safer, more potent innovations that are taken for granted in the developed countries. And in that respect, there is patent issues. Intellectual property is important and it must be protected. But also, we must ensure that these new innovations that must be also available to people who need them most. I'll give you HIV/AIDS as an example. HIV, about 40 million people who suffer from HIV/AIDS. 63% of these are home to Africa. Despite that, it took a full 10 years for Africa to be able to access antiretroviral therapy as a viable strategy due to affordability. Because until the cheaper generic versions were availed, antiretroviral therapy was unaffordable to Africans. And yet the majority of the sufferers are in Africa. Now, India, the source of most of these cheaper generics, has recently ratified the World Trade Organization patent laws. And it ceases to be a reliable source of these remedies, cheaper remedies for Africa. This is where the challenge is. What happens? Either these countries, poor countries, will have to commit more resources so that they continue treating the people, or people are going to die. This is where we come in, because the most effective, most cost-efficient, and most sustainable way of ensuring that Africa continues to access the affordable medicines is to transfer technology to Africa and help them manufacture these new innovation patent-free. Barring that, we will go back to the 1995 when antiretroviral therapy was not a strategy.
What I like about this example is it broadens the notion of value a little bit beyond what Michael Porter was talking about to essentially the industrial benefits and the job creation. And one of the things that we should reflect on in our conversation is whether we want to include that in our notion of value. I would argue that we should.
Technology is the most important contributors to the economic development, but also save lots of lives, thousands of lives, and but they also brought lots of financial burden, and also some medical harms to the people's life, especially in the country like China. So some of the hospitals and doctors, they introduced new technology and cannot use it properly to generate revenue. So this creates lots of problems with the irrational use of technology. And to just give you an example, last year, if we look at the outpatient expenses, average per capita is about 180 yuan. Out of that 180 yuan, 51% are from drugs. 29%, more than 29% are from checkup, examinations, use medical devices. So this situation has been changed a lot. I should say 3 years or 5 years ago, this can be 60, 70% from drugs, more than 20% from checkups. So the labor cost is rather less. So doctors were overusing prescription drugs, high new drugs, brown drugs, and overusing high tech like MRI, CT scanners. So my argument is that how can we spend our money wisely? We have China is developed countries with very limited resources on the health. Urgently, I think.
Margaret gave some great examples of combining technology and service delivery innovation. Wim really talked about how technological innovation, that MDR-TB drug that's under development, can improve the value of healthcare. Fredrick talked about how business innovation, domestic manufacturing, in his case the ARV factory, can improve the value of healthcare. And we raised the question of whether those industrial benefits should also be within our notion of value. And Dezhi talked about a social innovation, health technology assessment, and actually argued that the application of that in China has improved the value of healthcare. So that's where we're at in the conversation now. Many paths to get to innovation improving value.